Yeah.
Okay.
So, hi, nice to meet you.
Nice
um,
to meet
if
you
it's
too, Josh. Yeah.
possible, you could introduce yourself and just tell us a bit about what you do, and yeah, that'd be great.
Yeah, my name's Colin Brown. I'm a former Royal Marine teacher, and outdoor, very, very active, rugby, all sorts of expeditions, trekking all over the world, basically. And that's what I do, and that's the life I've led. And this is where it's brought me into pain. Uh, okay, through my former careers and the type of stuff that I used to do, it has caused obviously wear and tear on my thing. At the present moment, I work for myself, and I work in the field of leadership using the outdoors and management.
Oh,
Okay.
awesome. I didn't know that. Caris hadn't told us that.
Yeah, working with companies regarding leadership management and conflict management. Okay,
Oh, good.
so but my present physical situation, obviously, it's preventing me, and obviously the present climate being where we are, it's preventing me from doing my work. So I'm now in the process of well, I've been given a date for a hip replacement to rectify my osteoarthritis.
Okay, awesome. So it was osteoarthritis in your hip that.
Yeah, in my right hip. Yeah. There's nothing there. It's bone on bone. Very painful. And I've been over there 12 months, 18 months now. It's gradually got worse, and preventing me from leading an active life, and obviously uh, my fitness, which is I took pride in, is causing me. And I'm basically waiting, it affects also your mental health side of it as well.
Yeah, definitely.
Mm.
And is that a result of activity you've done over your lifetime, or is it just general?
Yeah,
Motor?
yes, it's through very active time for 22 years in the Royal Marines. I'm doing skiing, mountaineering, all sorts of things, jumping out of a helicopter, all that kind of stuff. And then obviously when I invented my teaching, I was PE games, outdoor ed, playing a lot of rugby, coaching, trekking, not a climbing, but a lot of trekking and skiing, taking school parties, school groups, adults, leading all over different parts of different mountains, different terrains, carrying heavy packs. And yeah, there's a lot of wear and tear there, in that area.
So the first tips had very good use then.
Yes, I've made sure they work them well, and I'm going to make sure I work the second one as well. Because as the orthopedic surgeon said, they are there to be used. So I just one of my things is I just want to get back out leading, and doing the kind of physical stuff that I really enjoy. Yeah, not to say I won't need a bit more, but you just got to keep going. Wear out, not rust out.
Yes,
That's what I say.
definitely. I really like that analogy. um, so obviously going back to kind of 18 months ago when you first started experiencing the pain, were there any
Yeah.
like, previous solutions that you tried and to try and resolve the
Well,
pain before
first
you
of all,
stage?
yeah, it came on over a period of time, and we thought it was disc problem, in lower back, because I do have a slight bit of osteoarthritis in the lower L region, the lower numbers of the L3, 4, I think it is. But that was the pain. Then we thought it was the sacroiliac joint. A very good physio of mine. So I was being given physio, all good, but we didn't actually know, or I didn't actually know exactly what the problem was. And it was for a period of time that was causing a lot of frustration and a lot of anger, about not knowing what's going on. And then obviously with the situation with the COVID came in, that prolonged it. And then we didn't know what was going to happen, when I was going to get to see a person. I was given, time spans of 18 to 2 years for an operation. So you can imagine that was playing on my mind. I lost work. So yeah, it was affecting me not only physically, but particularly mentally as well.
Yeah,
And financially as well.
yeah.
Yeah.
So
Uh,
just
we kept going. Sorry, go on.
it was just like normal physio through the NHS that you tried before?
Yeah, a very good friend of mine, who's yeah, we worked together through rugby, played together for many years, and my other friend, obviously Tom in the US, they all sort of give me advice and sent me stuff, and I would do, I would do the exercise. I start off well, but like anything, it just gets too much, and then I was just at that time it was just paracetamol and ibuprofen, which wasn't touching it. So then that's when I went back to the surgery, to my surgery, and then they upped my medication to cocodamol and naproxen. So that helped, but I don't like taking pills. I'm not a pill popper, so I found that not very nice. And then again, it came up. Finally, managed to get an X-ray around about September time, I think. And then that's when, for the first time ever, I saw my X-rays with the orthopedic surgeon, and it was osteoarthritis. And you can actually see the right hip. There's nothing between the ball and the socket. The cartilage completely gone, and it's quite, bone on bone, very painful. Which again caused me to become less mobile, and yeah, it's losing muscle density in my right leg as well. So that was causing the problems. And then eventually got through the arthritis, and due to my fitness and the way I've been conducting myself in the pain, I managed to get, not brought forward, but given an appointment for, he said, mid-January. But as I said to you earlier on, yesterday, the good news was that I have an X-ray next week, and then all being well, I'll be operated on the 1st of Feb.
And is that private or is that NHS surgery?
It's through the NHS, but it's at the Peninsula Medical School in Plymouth. Moved out of the Derriford, the main area. Was going to be over at the Nuffield, but it's through the NHS. So I do that. But in the meantime, also before Christmas, then you guys came on board and introduced me to the re.flex, and that helped because it became more disciplined. I was doing the exercises every day, but I knew, because I couldn't get to my physio, which was like once every fortnight, and then it was reliable on me. You would drift, you would do the exercises some days, other days you wouldn't, you do something different, but there was no consistency, no rhythm, no routine, whereby since I've been using the re.flex, it's given me that opportunity to have regular, knowing there's a physio there for me. At the end of the line, whether it be a phone call, whether it be a quick email, text, or whatever, there's somebody there. And the other thing is, it's quite funny. You feel as if you're being watched as well. Whether that's a good thing or a bad thing, I don't know. But it's all good. And I thought at first this would only be for rehab, but this is prehab, and I think that was important. That I could be able to do this stuff prior to my operation, and then knowing that once I have my operation, I can go back and carry on with an end goal.
And how do you feel now after conducting the exercises or being a part of the program for, I think, 7 weeks and 2 days, I think is how long you've been exercising for now. How do you feel as compared to, say, September time, or even at the start of the kind of re.flex process?
Well, completely different. It's because I've been doing my own exercise. I like Nordic walking, so I've been able to do that. Carry on, do my 5 30-minute sessions out yesterday. Just so I'm still able to do some form of exercise. My medication has been reduced. I'm only taking cocodamol maybe once, twice. Maybe once a day sometimes, and naproxen once in the morning. So I'm not reliant on them. I have good days, bad days, and sometimes it reflects on when I need. When I started, I was doing it religiously every day, and then I suddenly realized I need to take a break. So maybe I have 2 days off or like that thing. But yeah, it's completely different, because in that, before I did it, I wasn't sure what to do. in relation of relieving the pain, being more mobile on what I can do physically, exercise wise, and then obviously mentally. It helped in that area there. So yeah, there's been a change, and it's been a change for the good, because I feel that my attitude is that I train for the operation. I don't train, afterwards to get fit after I've had the operation. I'm training to be operated on. So when they can do it, get it done, back out, and then I'm training, get fit for an operation. Whereas I think some people, they think that they leave it, and then they don't. And then there's that long process then afterwards of rehab. I think possibly what they may have to do with me is put a leash on me for a bit, just to make sure that the time frame of the actual be sensible, taking into consideration my young age.
And how kind of on that point, because from you've been an exemplar patient for us, and how have you found the technical side of setting up the sensors, that kind of stuff, being an older patient in a sense?
What are you trying to say? You're trying to say something? Let's figure it out, young man. Please don't sit on the fence. No, being sometimes a technophobe is the word, I think. There's always some apprehension about, it's always the VHS recorder, isn't it? You chuck the booklet away and you try and do it. That's always the standard operation for everybody. Even you youngsters don't get it right. But no, once the simple, establish how the sensors work. Also, then looking around the site itself when you're in and looking at the exercises. I was finding things just the other day where you just press the rotation to recalibrate the sensors, things like that. Don't be afraid to stop the exercise, have a little bit of a break, or readjust. And if you readjust, you've got to recalibrate, because it says there, so it's reading and then getting to know the actual equipment really, and then following the routine. It takes about 15 minutes, 20 minutes, depending how I feel by the time I set it. The other thing, I now I know that I can set it up on my mantelpiece, and I normally do about between 6 and 7 o'clock in the evening, when it's a nice downtime, and it's all done and dusted. So I find it, I find it user friendly, I think is the word.
Mm-hmm. Yes, that's really good to know, and good to obviously for us to hear, and like you said, being a potential technophobe and kind of stuff like that it was pretty easy for you to adapt and learn how the kind of system works, and kind of overcome those concerns. But once you get used to it, then it's almost like second nature.
Yeah, and also the good thing is there is support there. So ask. You've got good support. Just ask you guys. Go back to you and say, you are my physios, or you are looking after me. So don't be afraid to ask about that. About how we can use it. I mean, one of the questions, like halfway through, I thought, why am I doing this? Because what's going to happen is they're going to go in and they're going to cut off that piece of the bone, which is the ball, and stick a new one in. So what am I doing? But as it was explained, it's all around the muscles, the routine, and just keeping it without seizing up, So it is important that you keep doing it prior to the actual new hip itself, and then obviously you're looking at the rehab afterwards.
Just a question: what's kind of, obviously, because you hadn't been exposed to it before, and obviously Karis had explained a little bit about what the kit does. What kind of surprised you the most about kind of the experience of using the re.flex sensors, the kind of service that we kind of provided alongside it? What was the most kind of surprising thing about that?
How accessible it was, how easy it was. I like the expression, it's a physio in your pocket, physio in your home. We're all certainly at the moment, the anxiety of if you take, if you're not in COVID, then you've got nobody else can come and see you, or you can't get things. But there is, you are getting some form of medical treatment, and that's knowing that you know, there's somebody there caring, somebody there looking after you, somebody there still wanting to make sure you get you fit, get you mobile again. And regardless of whether you're size, age, gender, or whatever, you know, you're in your own home, but you've got medical support, and there's somebody there helping you go through those routines, or whatever routines, you know, they whatever the routines you sort of you agree to, you know, and set out, because at the end of the day, it's tailored to you.
Mm-hmm.
You know, you're the experts, the physios. You sort of then say to me, right, we need you to, you've got this, we need you to do this kind of thing, you know.
Mm-hmm.
So
Did you find it easier because there was like a almost regimented plan of this is what you're going to do on this day, and you can
well,
follow up to like a week's time and see what your exercises are and how many reps you're doing and that kind of stuff?
there's got to be some you've got to have discipline about doing it, you know, and you've got to think of the end goal, you know. It's preparing for my operation, as I say. So yeah, I could do a couple of days and then say, oh, I've had enough of this, and just chuck it in the corner and it gets dust. And whenever you ring me up, oh yeah, I'm doing it, you know, it's like when, to be honest, you know, you go to your physio and you say to them, you know, you're in the physio department in the hospital, and Jabba, my mate, would say, have you done your exercise? I go, yeah, but knowing in the back of my mind, I haven't done them religiously.
Mm-hmm.
And you know, you get away with it, because some days it depends how you feel. But yeah, you've got to be, to get to benefit, especially, I think, and it'll tell when I start the rehab. That will be the, you know, how quickly I can be a small target, like I can be doing the exercises.
Mm-hmm.
I mean, obviously, I take it that once I have my new hip, the exercises will be adjusted and changed. You know, to what I need to do to get back. So that will be important. Yeah, but there's got to be some sort of discipline on your part, on
Yeah.
the person, you know, and not regimented. I don't like that word, but it's more about discipline.
Okay.
You know, do your routines, do, you know, and do them. And if you can only do 5, do 5. If you can't do 30, fine. You know, but just, and like a couple of times, it was a combination of pain and a combination of the technology, which we spoke about. And all you do is just you change it, reduce it. You know, don't go on to the next one, go on to the next exercise, and just try and complete what you can and do what you can regarding the exercise.
Yeah, definitely. That's great. And what are your kind of thoughts about, or whether it's excitement, or I'm not sure kind of how you can get excited about doing rehab after surgery, but about using the kit and continuing kind of the progress that you've made now post surgery. What are your motivations for, like you said, because for your motivations for using or sticking to this kind of plan was you're preparing for surgery. What's your motivations after?
To get mobile again,
Mm-hmm.
obviously, to get full use, and remembering as I said earlier, the hips are there to be used in the right way, not to rush. And maybe this will, you know, you will start off it'll be interesting to see my very first session with the equipment after surgery. How, you know, how soon after surgery do I put the sensors on?
Yeah.
And whether, you know, Caris wants me to do 40, or I don't think so. And whether I can do one, and again, there's the goals, isn't there? There's those little targets targets, you'll be set targets to try and do 4 of these, 5 of these, and then you get it in with becoming mobile, because the idea is that we want me to be using the hip and getting back to full mobility. You know, not, you know, I was looking at sports that I can't do anymore. Obviously, I don't play rugby anymore, but the one I at this point is skiing.
Mm-hmm.
You know, that says I better get back skiing. That takes a long time. But certainly the trekking, certainly other kind of stuff that I've done, swimming. You know, all the general kind of stuff. Then yeah, but it's the small stuff really. It's getting through that first week, and again. Listening to the advice of the orthopedic surgeon, listening to the advice of the physio, whereas on my rehab with you guys, I will have a physio every day if I want it, you know.
Yeah.
Whereas if it's a normal physio, I'd say, right, I'll book an appointment. I've got to see an appointment. Oh, I can't go into Derriford. Can't get an appointment. We're closing the department down. And thing. Whereas if I've got you guys, you're there at the end of the day. End of a Zoom, even if you know a Zoom kind of thing. So
and how did you find the interaction with the physiotherapist through the messaging kind of feature on it?
Well, you got to take into consideration my relationship with the. I've got to be careful what I say about that. But I think it's I like it. It's very professional. It's very straight, and you got to keep in mind, you know, this is not a messaging service. This is not a, you know, we're not there to say hi, how are you, and nice flowers and all that kind of stuff. We're there. We want serious, specific medical advice.
Yeah.
How to carry on and support. I think is a big word. Is support. You know, support and advice on how to do the exercise and carry out it correctly. You know, and do it well. Do it well, and I'll be ready. I'll be chasing you, boy.
I need to get fit. Just another question, if that's all right. What would you tell someone who's considering using the re.flex sensors? Say someone in your position, or going towards surgery, or you know.
I would say give it a go. Absolutely, take it. It's a tool. There's lots of tools out there. It may not suit them, or they may not like it, but give it a go. Get it on board. Give it a try. Go through a series of exercises. If you have to change the exercise, change them. Speak to the physios, but definitely give it a go, because it is a positive. It's a really positive piece of equipment that has certainly helped me prepare for my operation.
And we can only hope that it continues to do that after your surgery as well. Kind of just
go
on. Just reflecting on kind of the process. Was there anything that we could have done differently to kind of improve our kind of service and kind of support you a bit further, like in your rehab process?
Well, as I say, at the moment, I'm getting into surgery, and I think reading some of the literature and some of the stuff, a lot of your work would be focused on rehabilitation, on the rehab. So I'm looking forward to that. Well, I know it will work because you're professional people, and that's important. You know your stuff, and I've got to trust you. You know, that's the word. There's got to be an element of trust there. Whilst I'm sitting in my home, I'm trusting you to guide me and through the process using your product, which I'm more than pleased with at the moment, because, as I say, it's helping me. I'm feeling a lot. You know, I'm not apprehensive about my surgery. I think if I just sat around not doing anything, and then maybe it would have been. But no, I think I'm ready. I'm looking forward to it. I'm ready to go. I'm ready to get back on and do the rehab.
Yeah, definitely. Well, it's exciting. It's just really nice to see. I've not spoken to many patients yet, because I'm from a business development background and academic kind of background. So it's great to see a really refreshing and unique perspective on kind of what surgery is, and to almost not attack it, say, but to go into it the right mindset of coming out of it the other side in the best possible condition, and then recovering in the best possible way as well. It's really unique impression to see that.
Yeah, you know, it's been a great help. You know, it's been an important part of the process for me, and certainly because I used to go and book my appointments at the physio department. I would go, and I'd have my physio. I'd have an hour. I mean, all right, Paul's my very good friend of mine, but we'd have a chat. But I'd still get treatment. But there would be 6 days, 7 days, 10 days between treatments. And in that time, you could be down, you could be a little bit, having a bad day. But with this, you strap it on and then you just get working. and there's somebody there for you. So yeah, there you go.
Thank you. Is there any other comments or you'd like to say about the Reflex service or the product?
No, not really. Just as I say, I'm now looking forward to it when I get my operation done, really. And so quickly you guys get me back.
Well, that's a challenge that we're willing to accept and to try and recover you as soon as possible. I'll just stop the recording there. Thank you very much.